Okay, so it is 5:01, and I'd like to begin the Board of Health meeting for today, August 9th, 2021. In keeping with an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law by Governor Baker on June 16th, 2021, this meeting will be conducted remotely over Zoom. Attendance by the board members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on ECAT. And should I read the rest of the bullets?
Yes.
Okay.
Yep.
To use Zoom, you will need to use the link on the agenda or download the Zoom application at www.zoom.us and create an account, or use one of the call-in numbers listed on the agenda. You will need the webinar ID to join by phone only. While conducting meetings remotely, we will endeavor to keep meeting operations as close to our standard procedures as possible. However, use of this platform will necessitate some additional meeting protocols. One, while the board members or commissioners and applicants will be on video and audio, public participants, will join the webinar as attendee, meaning they are muted with no video feed from them. During the public testimony portion of the meeting, members of the public can be recognized by using the raise hand function found under participants from Zoom, or make a request with the Q&A function. If you're joining only by phone, you can press *9 to raise your hand. If an applicant wishes to display materials, please make the request of the chair and the email materials to board staff for sharing on screen. When starting testimony, please state your name and address for the record. There is a markup function in Zoom which will allow you to call out specific areas of presentation materials. As in any public meeting, indecent behavior will not be tolerated, and anyone who abuses use of the meeting platform will be terminated from the meeting. Business will be handled at the times indicated on the agenda. Business not concluded in the allotted time will be tabled to the end of the meeting to allow for timely logins and remote attendance. Board members are asked to announce themselves when making a motion and second, so that it will be clear to the audience and minute takers who've made motions. All votes will be by roll call. Okay, so let's begin. The first item is to accept the minutes from July 12th, 2021.
Motion to accept the minutes is read.
Zayas seconded.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. And then we have no variances tonight, so we're going to skip right out to action and discussion. And the first item is the novel coronavirus update. Blah.
Right, and if I can find the PowerPoint, is okay. It has been a while since this update has necessitated the use of slides, but given the changing status, I felt it was kind of important to get some visual cues up there for everybody and be able to explain some of the data that people may or may not be seeing. So first off, where we are today, I've used this slide a number of times in the past. Oops. Jeez. Okay, I'm trying to move my little film strip of your faces so that I can see the slide. There we go. I know back in July, I had reported very happily that we had finally had a 2-week period where we were seeing 0 cases in 2 weeks. That was for the data range of June 27th through July 10th. I believe at the time I might have said we were cautiously optimistic, but with the 4th of July holiday falling in there, we wouldn't be caught off guard if we saw some cases. So when we jump to the next 2-week period, and if for everybody's information, the state reports and kind of jumps ahead a week at a time, but does 2 weeks worth of data when they combine these numbers. And as you can see from the chart, we posted a 6, we doubled plus to 15, we doubled plus to 32. And what I'm showing on this slide right now, the July 25th to August 7th, with the 36 cases, that number is a little on the premature side. We don't have all the reporting data in and posted yet for testing that may have been done Friday or Saturday of last week. We are seeing some of the tests actually taking a little bit longer to get into Maven. So I would expect that that 36 may tick up by a couple of cases. One of the things that I'm noticing as I look at these numbers and these cases as they come through is prior to hitting that 0, as we were in the steady decline, I often said what we were seeing was spread within households. Now, what I'm seeing is I'm not seeing the reporting within households. So when I look at that number of 36 positives for that date range, and I look at addresses and I look at names, that's representing more accurately, I'm guesstimating based on what the last time I looked at it, that's representing more than 30 households that have a positive. In the past, I think when we had that 6, that represented 2 households. So I don't know if part of why that is happening is now people have the ability to buy the very accurate Buy Next Now antigen test at CVS. So when a member of a household becomes positive, what we're hearing is that people will go out and buy the Buy Next and test their other family members. And we've all gotten very smart and we all know how to deal with COVID in our houses. And we're seeing people do their own response, and we're not seeing the reporting of it. So part of me thinks that this number is actually higher because of that dynamic, that people are able to test and say, okay, the kids are positive, we're going to keep them home, but it's not reported anywhere. That's my theory. That's based on some conversations with the state. That's based on the fact that you can walk into CVS and buy the Buy Next Now, and it is a very valuable tool. But I also think we have to maybe look at this number as possibly being a little bit lower than it actually is. How does that put us within the county, and where does that put us with our average daily incident rate? That puts us with an average daily incident rate of 9.3 per 100,000. Again, we are a population of under 25,000. So everybody, to level the playing field so that we're all talking apples to apples. These are how we do it, is we multiply up to per 100,000. The thing about this data that we're looking at is that 9.3 is based on the cases with the starting date range, if you look up in the upper right-hand corner, of July 18th to July 31st. We won't have the next update on this, which will then cover the 25th of July through August 7th, that 36 that I said may fluctuate. We won't have the actual data pull and reporting of that until this coming Thursday. So the 12th, we would get every week they update this chart. And then by then the data is reflective almost 2.5 weeks. When we look at the Commonwealth, Bristol County is at 12.5 per 100,000. So Easton is slightly below what we're seeing in some other parts of the county. According to CDC, they use a 7-day rolling average per 100,000. They have Bristol County currently at 134.46 cases per 100,000 of population, over the past 7 days. That puts us, based on CDC's statures, at a high community transmission level. It's definitely higher numbers than we've seen in a while. This is an interesting statistic, though, as I segue over to the fact that the vaccines are still one of our most useful tools. We all know we're seeing breakthrough. We all know we're seeing the Delta variant impact the numbers. We all know that the Delta variant is definitely more communicable, that it is affecting people who are vaccinated. But what this data set is showing us is that 99% of our cases are still in those people that are unvaccinated. And if we look at Easton's numbers, we can see this chart has a breakdown and is showing you by age where we are with our full vaccination rate. And we're doing really well as we get up into the 50 and older range. Obviously, the 12 to 15-year-old range have only been able to get the vaccine for a much shorter period of time. They are only able to get one type of vaccine. We as a town and as a department, in conjunction with the fire department and the school department, have been targeting this population and trying to provide opportunities for those 12 to 18-year-olds to receive the Pfizer vaccine. This coming Thursday, we will be hosting a second dose clinic. We have, I believe, 40 people registered, 40 more residents that are registered to get their second dose this coming Thursday. But we still are not in great shape with our numbers under 30, and even our 30 to 49 range. I'd love to see that number a little bit higher. What's next? Communities with this spike that we are seeing, communities are beginning to implement additional steps that have helped in the past. There are a number of communities that in the past week have implemented some type of mask mandate. There are communities that are starting out with just their own buildings. There are communities that are pushing it out to all public buildings. But we've also seen the businesses being very responsive and protective of their employees as we go into this too, where I think some of the businesses have been ahead of even some of the towns in saying, you know what, we want everybody to be safe, and it's just safer if we are indoors, if we are all wearing masks, and then there's, that much less chance of anything happening. We are starting to see communities and businesses mandate vaccine. Some of the large companies are moving in that direction. And recently, I believe it was New Bedford may have announced at the end of last week their intention to mandate vaccines for their employees as well. I'm going to use this as a segue and propose kind of a next step for the Board of Health. One area where, and we are hopeful that the state is going to start providing us with more concrete direction. We have our weekly Department of Public Health call this coming tomorrow afternoon. Wednesday, there's also a call that DESE is scheduling with a lot of the superintendents, and they're going to be going over some of their strategies for the fall. But one area where the CDC and the Commonwealth are not completely aligning is, well, the CDC has come out very strongly in recommending that masks be worn by all people in the school environment. And what I would suggest at this time is that I have drafted a position statement that if the board is in agreement with the CDC's recommendation, could potentially be used as a tool to communicate to the school committee and the community at large that this is a step that CDC has proposed and that the Board of Health is behind. I can go over kind of the bullets as to what's kind of leading to this. We've all witnessed a change in the pandemic due to the Delta variant. We all know the Delta variant is more contagious. We know it is still rare for people who are vaccinated to become ill, but we're learning that even people who are vaccinated are able to build up to a viral load where they are able to spread. We all know that the risk is much lower if you're vaccinated, but we are in a position right now where we're not able to vaccinate our youth that are under the age of 12. Even a small spread of the virus in the school population is extremely disruptive to the community. Right now, there haven't been any changes other than if you're vaccinated, you don't need to quarantine. But we will be returning to school with no cohorting, full kids in the classroom, and masking, in the opinion of the CDC, is one of the best ways to provide an additional level of protection for the teachers, the staff, the students, and the visitors. The goal of this document would be to kind of pretty much get behind what CDC is recommending and let the community and the school department know that that is what the Board of Health would be recommending. If you have not had a chance to, went out, it was supposed to be in the packet, it ended up being finalized and not getting out to you till the last minute. I don't know if anybody has any questions, any feelings right now.
So this is, we're gonna, this will open us up, I'm thinking, for a thoughtful conversation about masking in schools and what our position is about masking in schools at this time based on the information we have. Does anybody have any comments, questions?
I have a comment. My personal feelings aside, I'm very nervous to comment on anything that the school should do because history has shown that we unfortunately don't have any authority over what they do. They make their own decisions, which is completely fine. And I have zero problem with that whatsoever. So I don't necessarily know if it's safe, prudent, or, even in good taste that we make any recommendation over what the schools do when they may have different information. They may disagree with us. Why start a rift? I kind of feel that if I'm going to word this poorly, but if we not necessarily had been involved, because I totally get it, like that we're two separate entities, as well as Health and Human Services are separate from the Board of Health and everything like that. I just feel that where we have not commented on the schools or have made any recommendations one way or another from the get-go, that I'm very reluctant to start now. It's not trying to start a rift or anything like that. It's just that's the way our system is set up, of which I have zero problem with. I'll live by that regardless. I think that we've done, and the Board of Health, you guys have done an amazing job in educating the public and giving everybody the tools on what they need to do to protect themselves. I don't find it necessary right now for me as a representative of the Board of Health to say, this is what you need to be doing. You know what you need to be doing. Get vaccinated, wear a mask if you're uncomfortable, be smart. I just, again, I don't mean to be long-winded. I just am very, very cautious as to take any type of statement or make any comment as far as what I'm aligned with or what I feel the school should be doing. I did read that document that we got about 15 minutes ago, which is, well worded. I don't want to comment on anything on the school side. That's just me, and I'm totally fine with whatever the majority wants to do.
So thank you, Chris. And I can understand why you might be uncomfortable with, sharing what your thoughts are on that. Kristen, any idea if, and maybe this is just hearsay, if they're even looking for our thoughts on this? We don't want to step on toes. And Aria, do you have any questions or comments?
No, I agree with being smart. People know what they need to be doing. And I agree also, is the public schools asking us for our opinion? And, if so, has something changed between last school year and this school year, where now we're being requested to be involved?
I think one of the differences this year is that the Commonwealth is leaving it to, at this point, leaving it to communities. In discussions, the Board of Health's opinion is valued on a lot of topics. And looking at the calendar, knowing that we all have, scheduling meetings and things that are wrapping up, and before we know it, the kids are going to be back in the classrooms. This would not be a recommendation. This is basically a position statement that you are giving them as a tool and giving the community as a tool, that you are in alignment with CDC's requirement. It has been indicated to me that the school committee will be looking for the Board of Health's opinion, for the Board of Health to weigh in. This is, on my part, I feel like we're going to end up crunched for time, that if the Board of Health is in agreement with CDC's recommendations, this is a very easy way to let the school committee know that we're in alignment, that you're in alignment with CDC's recommendations, so that they can plan and go forward and start the conversation. But it's at least acknowledging where the Board of Health stands on this, to start that conversation.
And thank you, Kristen and Aria. So if we were to make a statement, would it be understood that how we feel now could change if in 3 weeks something drastically changes for the better or whatnot? We're making this decision based on what we know right now, and basically based on that knowledge and data, what we predict for 3 weeks. And if we do share what our opinion is, how is that done? Is it done by roll call, or are we just having a thoughtful conversation? What does that look like?
You could make a motion to issue this position statement to the community and school committee by extension, that you are in alignment with CDC's recommendation for masking of all in the schools based on the situation today. As Lynn, as you said, the situation could change 3 weeks from now, and adjustments could be made at that point to the Board of Health's position. The governor may make a determination and change his position as far as how much guidance he's giving one way or the other. But this is a way of acknowledging right out of the gate and giving the school committee and the community a tool, rather than us trying to schedule an emergency meeting and waiting as we get closer. Because what we know today is that masking across our schools last year greatly contributed to the lack of documented spread of COVID within our schools. And where we do have a large percentage of the enrolled kids in the school that are not even eligible for the vaccine. And this is what CDC is recommending. this is an opportunity for you to come out early on and provide that information to the community that you are in alignment with those recommendations.
Okay. It's a little unusual to do it this far in advance, but I understand what you're saying about giving preliminary like guidance or our opinion towards whatever, you know. The
How about this?
decisions will be.
When, again, I emphatically am not going to comment on any school related stuff or what they should or shouldn't be doing, nor am I an expert on that end of things. That being said, when is the school committee meeting again? Like, I know what Kristen's saying, like we're short on time and everything like that. I'll meet whenever, but it just.
Chris, I'm going to pause for 1 second. I got to go get my charger. My computer's about to die. I will be right back. I believe the next scheduled school committee meeting is August 26th, which the kids are back in school the week after that. I personally am unavailable for any meetings, night meetings next week and no meetings the week after. So let me go before my computer dies. I'll be right back.
I can't believe we can hear all the steps. I think we should wait for her to come back if we keep talking, just so she can hear. Looks like we have somebody in queue, and it's Jackie Weissman. The next school committee meeting is the 26th, but we may try to schedule an earlier one.
All right, sorry about that. Yep, so as one of the members of the audience said, and I was correct, the next school committee meeting is the 26th. As stated, I believe in being proactive. Whew, 2 flights of stairs.
Take a minute, Kristen, take a minute. Take a minute. I want to say that, the one,
Lynn,
I will
froze.
share it, but the one part that's missing in all this is
You froze.
Am I on now?
Yep.
What school's going to look like? We don't know. We don't know what school's really going to look like because the state regulating bodies, DESE, DPH, everybody else haven't really made any decisions. But I'm anticipating it's going to be a lot, kids are going to be a lot closer together. They're saying no cohorts, yada, yada. So as we move into the new school year, my assumption, and I could be completely wrong, is that the kids are going to be closer together. Things are going to loosen up a little in terms of what we've done before, not necessarily the mitigating strategies we use like hand washing and potentially masks, but other things like how far away you sit when you eat or how far away you sit when you're in class. I don't know if anyone knows what that's going to look like yet. So it's kind of hard to make this call in that vacuum. I know in
the spring it was discussed, maybe even Mrs. O'Neill, that there would be like a joint meeting or something like that. I'd be open to have a roundtable discussion doing it that way if time permitted, and I would make time for that, but I am not, I just don't, the statement that we got a half hour ago, which I read it, I tried reading it twice, it's actually perfect, but I just don't want to comment on anything school related as a board or as a individual or as a paramedic. It just, I can't make that comment right now. It'd be, especially where I'm afraid if I make a comment a week from now, someone's going to turn around and say, well, you didn't have any input a year ago. You didn't do anything, back then. What's the difference now? And I understand that. I just don't want to open myself or the board up to anything. I don't think it's necessarily a liability, but
one of the big differences between last year and this year is the tone thus far. And again, it could change in a press conference in an hour. The tone thus far has been individual communities know their communities. We're giving you tools. You make your own decisions. And this is an opportunity. I just saw this as an opportunity for, given the timeline that we're looking at, and the availability then to, unfortunately, a roundtable really isn't an option. We need to meet at posted meetings. We need to have quorums to have a discussion. So in coordinating two boards and committees in the final weeks of the summer, I figured I would put the proposal in front of you that if it was a simple decision for all of you that you were in agreement with CDC's recommendations, that tool in the form of a document could be given to the school committee. We could schedule meetings further, going forward. They could formally invite you. I mean, I don't even think that's necessary. I mean, but you could invite them to yours. You could go to them. The problem is when you look at the calendar and you start to really realize that 3 weeks from today, everything needs to be settled, because 3 weeks and a day from today, the kids are walking in the classrooms.
So
yeah, I don't see how a position that we make right now has any effect on that. I mean that respectfully and sincerely, but the document we just got a half hour ago, I haven't even really had time to digest. I'm fairly confident that I agree with everything, but I'm not 100% yet because I haven't read it. I unfortunately need to read things 6 times, but would it make sense for, as I mentioned, I'm not going to be available for evening meetings next week, and I am not available the week after. And the school committee isn't meeting until the 26th, although we all have the ability to schedule meetings as long as we keep within the framework of the open meeting law. Sure.
Would it make sense for the Board of Health to possibly reconvene on this coming Thursday to decide whether or not they want to act and issue a position statement?
So I'd like to step in here. I'm not available on Thursday, but maybe we can find another date. I want to first, I'm glad that we're being included in this. I do, and I really am. I do feel like it's harder to make, as I said earlier, to make this decision not knowing what the school year is going to look like. But that being said, I do feel at the start of the school year, if the state regulating bodies haven't given us much guidance on this, and if we stay in the high rate of transmission, whatever that be, and if school's going to go back kind of business as usual, full in school, kids are going to be close together, that I do think that at the very least, at the start of the school year, that wearing a mask is something that I think would be a good idea. So I do feel comfortable, although I totally recognize what Chris is saying and I respect him for it. If all those things I say are the way they're going to be, I do feel comfortable making that comment. Aria, do you have any thoughts on any of this?
Yeah, I mean, I was just thinking how, I think as a Board of Health, I don't know how we could sort of say we disagree with the CDC guidelines. I mean, it's science that this is keeping people safe. I think we all want our children to be safe. And whatever we say here isn't necessarily what the school committee is going to vote on. They're going to do their own thing. So for me personally, I absolutely am comfortable making a motion to move forward with the proposal in line with the CDC guidance. So I don't know if we just want to move forward at this point and roll call it.
I just want to be clear. I'm fine with that. I'm 100% behind what the CDC recommends. I don't see the need or really the sense of urgency or the immense persuasion it is to do it in conjunction in direction towards the schools. I'm happy to say I personally do agree with the CDC guidelines. I think
it's
one of the big
in regards to the school, I think, because the CDC has guidelines for everything, but they actually specifically did kind of pull out what they want in the school. So I think that's kind of why we're here.
Yeah, has had different silos. They have had a recommendation for schools, in-person learning. They've had a recommendation for healthcare facilities. They have recommendations for other silos. The general public one is different than the Commonwealth's. Right now, the general public one for going indoors is that everybody should wear a mask. They would recommend everyone wear a mask. If they have anybody at home, there's one subtle difference in the CDC's recommendation takes into account the fact that children under 12 can't be vaccinated and says if you have anybody in your household who cannot be vaccinated, you should be wearing a mask indoors. Whereas for some reason, the governor has said if you have an unvaccinated adult in your home, which is kind of really hard to reconcile. I have started wearing a mask indoors in certain situations because I am a caregiver to a 15-month-old 1 day a week. So I really take protecting her as part of, what I need to do, even though I am vaccinated. I think, one of the big things is we're seeing in the comments that the school committee, as well as I think the community in general, would like to know if this particular silo, and we may be back in short order looking to do, as I mentioned, some of these other steps that some other communities are doing as far as, if you remember back when this all started, we did implement a mask mandate before the governor did. We did have to implement some other steps locally. And we may, if we continue to see the high transmission, we may be back together considering some other recommendations or actions to those individual and unique populations. This is a population that is, the CDC has a separate set of recommendations for when it comes to being indoors, based on a lot of different factors, the contagiousness of the Delta variant, the inability to vaccinate young children, the fact that we will be back in, everybody wants to be back in person. The governor and DESE are calling for everybody to be back in person, no hybrid, no virtual learning. And the fact that the masks do provide that extra level of protection, and that we ourselves saw it. We had no documented transmission in the schools last year. It is, again, to me, I'm looking at the calendar and I am seeing, I wish I had tools from the governor right now. I think the school committee, not to put words in their mouths or in Superintendent Cabral's mouths, but I wish we all had a lot more direction other than your community better than anybody. And yes, we do know our community better than anybody, but we also are smart enough to look outside of our community and say, the Centers for Disease Control and Prevention has issued this recommendation. And, my question to you all is, are you comfortable telling the community at large and letting families know and other policymakers know that you are in alignment. They are asking, yes, last year, again, we're learning as much as we're learning more about the Delta variant now than we knew about COVID at the beginning. We're also learning that we need to work together on some of these things. And we're learning that they did want our input, that they do want our input. So this is, on my part, kind of a proactive attempt to give them that guidance that you are, and that backing that you're in alignment with CDC's recommendations as they pertain to schools. That is what I'm trying to do, knowing when I look at the calendar and I look at my availability, I look at school being back in session in a matter of weeks, and our ability to come together as the Board of Health. I thought I would present this opportunity tonight, and we can go out, later into the week. We need 48 hours to post a meeting if you want to take a pause and come back to this. But that's completely up to you.
So I truly respect both my board members' feelings on this. I'm appreciative of the opportunity to express how I feel. And with all that, I would make a motion to, I'm not even sure of the wording, of the recommendation that at the beginning of the school year, all things considered, if they stay the same, that the kids are masked, and that we could have some ongoing input if things were to change at the beginning of the school year or thereafter, or at least be able to give our input.
So
I make a motion.
Masked in accordance with CDC's recommendation?
Correct.
Okay.
So
I second.
probably a stupid question, but does this mean moving forward we're going to be involved with those types of things? Or is this just a one-time thing for them to use us as a tool to help convey the message to their people?
I don't think anybody is using anybody as a tool. I think we've learned lessons, and this is, again, in the past, we didn't have clear guidance from CDC. We didn't have clear guidance at different points from our local government. At this point in time, we do have clear guidance from CDC. We have a committee in town that is asking for our input. I think the community would like to have your input. And this isn't something unique that we're asking you to create and speak out. What I'm proposing is that you either table it or come out in agreement with CDC's recommendation. And yes, I think we're all in a very different place than we were a year ago or even 6 months ago.
Oh, I'm completely fine with agreeing with the CDC. I agree with it. I mean, if that helps makes things easier, that's fine.
I hear your concerns, Chris, and I also have
let's
concerns.
vote.
So please know that. I think, and I value everything you've said. I'm hoping that this is a beginning where we can offer our opinion on other things, and this isn't a one and done kind of thing.
And I don't think it potentially will not be the last time that, because of timelines, because of conflicting schedules, that I may be coming to you with kind of a preemptive, where are you on this particular item, so that the flow can keep going without having to try to align two full board and committee and two support staffs into one meeting when, this to me is a pretty cut and dry thing, backing the CDC's recommendation and letting everybody know that that's how you feel.
And I think I just want to point out that last year, the CDC would make recommendations, but then DESE did override some of those recommendations, which is what drove what happened in the schools. Right now, it's just CDC, so it makes it kind of a unique situation. Honestly, in the school setting, we didn't follow everything CDC said because DESE came forth in conjunction with the DPH and they made other recommendations. So I think that's why right now we're really just hearing from CDC. And so that's kind of where we're at. We can just deal with what the CDC said.
I also think, Chris, to your point and to your, obviously, I think it's the Board of Health's desire to work collaboratively. I'm going to note that there are at least a couple of members in the school committee in attendance at your meeting tonight, and that they are indicating through the Q&A feature that they would like your input and they would welcome a continued dialogue on these types of subjects with the Board of Health. And I hope I'm not misrepresenting that. And if I am, I would encourage one of the members who is in the chat in the question and answer to correct me. But I think I'm accurately representing that there's a bridge and that we are all hopeful that we'll be using it much more in the coming months and in the coming years.
Well, let's get our vote on.
All right. I'm going to make the motion. Okay. I make a motion to issue the Board of Health position in line with the CDC regarding students K through 12 wearing masks indoors in school.
I second. All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Thank you, guys. Thank you for really putting a lot of thought into the situation. It's not an easy thing.
No.
But, so I guess we should move on, but I'm stuck in the screen, Kristen, that you.
I need to stop screen sharing.
Okay.
All right.
Thanks, guys. So now, I just lost it. I think the next thing on the agenda was the arbovirus, tick-borne and mosquito-borne illness.
Yep. So,
This is really like a bad news meeting. If COVID doesn't kill you, the bugs will.
It's a downer. I agree. I'm like sweating.
Maybe we can close the playground too.
outdoors is good.
Halloween's next, people. Yeah.
Oh, so the mosquitoes are brutal right now. I know it's because of the wet weather we've had, or most likely. And so where are we at with that? Do we have any good news?
No. It's the cycles of the wet and the dry. Good news in that, and I think I think we've touched on it already, and Chris had said, we really try to approach a lot of these situations and scenarios from a perspective of the more we can do to educate, the better the outcomes are. And whether that's us taking the time to talk to a restaurant owner about why it's important to sanitize or why it's important to keep temperatures in the right range, that I think when people understand the reasons or are given the educational pieces and the tools to be able to protect themselves and help the community, we generally see that. And that's where I think we are in a lot of ways with mosquitoes, because there's a lot we can do as individuals. The buck slip is being sent out with the water bills that will give people good information on things that they can do around their home and steps that they can take to protect themselves while they're out and about. We have started, I'm trying to work with a limited number of graphics that I have in my toolbox right now to put reminders out on the town social media pages as to some of the little things that people can do, especially the emptying of water, standing water around their yards. And you know what, every time you go out, if you go out with a fresh pair of eyes, I myself didn't realize that the cover I was using to cover my fire pit was actually trapping water. And it's just going out and looking at those those same areas over and over, but looking for ways that possibly we can disrupt the breeding cycle. We are working with, there is one of the good things that came out of COVID was the Academic Public Health Corps. It originally started out with a different name and it had the word volunteer in it. It has become much more legitimized and much more organized in the past year. And it does involve students and faculty at 14, I believe it's at least 14 institutions in the Commonwealth who have majors and study areas that involve public health. So I've met with them and they are going to advertise basically for us for a position for somebody who is incredibly savvy to start building us a social media toolkit that we can tap into that has those very graphic and very simple, here's what you can do type of things. The state produces some good items, but a lot of them, they're just, if you've seen a couple of the posts I've done, when I try to get them down, they become very fuzzy and I'm not the most tech savvy individual. So we're going to be bringing somebody on to help build the toolkit initially for mosquitoes and ticks. And then hopefully that person will also help us, I think, develop some good flu material. And as we go through some of the other areas that we deal with. The second area that there's good news on is tomorrow I will be meeting with one of the professors at Boston University who is looking, we're going to be talking to regarding our possible alliance with MetroBridge, which is a program I've worked with wearing other hats on the age-friendly side of things that partners municipalities with teachers and takes a job we need done or a task we need done that's kind of outside of our areas and allows the teachers to use that material as real life class material for their students. So we needed help conducting AARP's survey. It's a very prescriptive survey. It needed to be mailed out. It needed to be statistically significant. And we had a professor do that for us through MetroBridge. What we're partnering with MetroBridge through on for the coming potentially 2 semesters will be basically undertaking an educational and a fact-finding or I guess pulse taking on where the community sits on the issue of aerial spraying. If you'll remember back in May, there was a lot of talk and there was some definite ask for the Board of Health to weigh in and the select board then to make an application for us to ask to be able to opt out of aerial spraying by the state. And just to go back again, that the ground spraying is done by Bristol County Mosquito Control. That's done ongoing. People can opt in, they can opt out. People can request that their properties not be sprayed. Bristol County Mosquito Control Project also does a lot of other activities based at mitigating mosquito. They clean out standing water. They'll advise individual property owners on areas on their property that might be of concern. They treat catch basins for us. They go out and do brush cut to try to eliminate more and more and disrupt more and more without using chemicals, the breeding cycle of mosquitoes. The decision to aerial spray is actually a decision made at the state level, and that's made in response to what is viewed by them as a high risk situation with EEE. They have, as they've formed a task force that's looking at arborvirus going forward, we've got climate change pieces, we've got chemicals that are, questioned about their pervasiveness in the environment. With all of that going on, one of the things that has come out of it is that municipalities can ask to opt out of that aerial spraying, but you need to present a plan of what you're going to do instead. we don't really have an easy way, and there is no easy way to say the majority of the town feels this way. So that's what we're going to partner with Metro Bridge for, is to go out into the community, do some education, make sure people are clear on what Bristol County Mosquito Control does, what the aerial spraying is, and what would be necessary to opt out of it. And is that something that the community in large wants to do? So that's kind of exciting, that we'll have that opportunity to have Boston University leading a conversation community-wide on mosquito control going forward. Other good news, there's West Nile in the area, but that's all I have to say. Mark, do you have anything else to say? You're giving me
don't jinx us. Don't jinx us.
I know. Okay, so anybody have any comments or questions about our mosquitoes and ticks? Nothing? Okay.
Actually, I do have one other, again, on that note of education and it being a very valuable tool. In the past, Mark has gone into the schools and again, through a partnership with the schools, has presented to the fourth graders for 5 or 6 years now.
Yeah, about that.
Yeah, a curriculum piece that was developed at the state level called Bite Lab that deals with mosquitoes and ticks. And it's actually written in that kind of, I think, 3rd to 6th grade comprehension level.
Yeah, there's 2 pamphlets. One's a 4th grade pamphlet, one's a 6th grade.
And we've been, when we first approached the school and said, hey, can we come in and present? We were welcomed with open arms. It evolved because we were one of the few communities that were actually using this tool, that the state gave us our own version of it and said, here, keep it. Stop asking us if you can borrow it. You guys use it. You do well. Please have one. And now Mark has the pleasure of storing it. Last year, obviously, we weren't able to do it because of COVID. Mark videotaped it and it was presented to the kids. The videotape was again used this year. We're looking at expanding that. We're reaching out to Maplewood. I've already had a preliminary conversation. They want more information. And we're going to reach out to the NRT and see if possibly that's another venue where we can kind of get this little curriculum piece in and get families talking about why we want to avoid mosquito bites and giving those kids that little bit of knowledge that, it's a good idea to protect myself versus fighting with my parents about putting on bug spray or long pants.
You might want a booster video for the high schoolers, Mark.
We may actually, it's one of the things that, when we have a minute to breathe, we could possibly work on doing another version of the videotaping. We're also looking at other areas in the community that we could use this as an informational tool. Mark and I had discussed with the recreation director that we could possibly do this at the children's races that happen on Thursdays. Unfortunately, they've gotten rained out, I think 3 out of the past 4 weeks. So we're looking for ways, again, I think education and knowledge is power. And we're going to continue to make sure that and take the time to explain to people the differences between what Bristol County Mosquito Control does and how to apply some of their principles, because they do a lot more for us than just spray. And if anybody wanted to take a look at the details of what they do for us, they do contribute to the town's annual report. Bristol County Mosquito Control has its own, I think it's almost a 2-page report and accounting of everything that they do, from cleaning the catch basins to brush cutting, and there's acres and everything that they list out. So I think we're moving in the right direction with that. I'm not going to say much more about mosquitoes.
Okay, so thank you. So next on the action discussion list is the authorization of Health Inspector Mark Taylor to issue local upgrade approvals during Director Kennedy's vacation, 8/14 to 8/29.
Yep. So this is a step that I typically don't go on vacations that are quite as long as this one will be. I did take a long vacation, I think it was 3 years ago, and I asked the board to do this as well. I will be checking in, but if I don't have to address this piece of my job, this will give me a little bit more of a vacation, but it will also keep the permitting process running smoothly. If I have technical difficulties and can't get on, I really don't feel that people should have to delay upgrading. And these are only issued in the upgrading situation where somebody has a failed septic system. And I'm confident that Mark can handle for the 2 weeks that I would not be checking in on this particular portal, issuing these local upgrade approvals. So I would ask the board that they authorize Mark to do this step while I'm on vacation.
I'll make a motion to authorize Mark Taylor to act on Kristen's behalf in her absence for the 2 weeks.
On local upgrade approvals.
That too.
Okay. I second. All those in favor?
Mills, yes. I read your lips, Aria.
Zayas, yes, sorry.
LeBlanc, yes. Okay, and then we have a betterment application for 48 Norton Ave.
Yes, so all 4 of these addresses, we could probably do it as one big batch. They're obviously all in failure. They're all looking for the $45,000 each to upgrade their septic system. They're in good standing with the town in terms of their bills. So, and their applications are complete.
Anybody want to make a motion?
I make a motion to approve the betterment applications for 48 Norton Ave, 100 Chester Street, 46 Caroline Road, and 451 Bay Road.
Second.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. And that looks like it is it for tonight, unless there's anything else.
No, let me check the question and answer one more time. There is a thank you to the board for their thoughtful discussion on the masking issue. There is, as I had mentioned before, input from school committee members saying that they feel the families would value your input, which was already conveyed to you. So I'm not seeing any additional comments or questions in the question and answer.
Okay, that's great. Thanks, everyone. I'd like to make a motion to adjourn the meeting for August 9th at 6:03 p.m.
Second.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. All right, thanks, guys.
Bye.
Thank you.
Thank you. Bye-bye.